there are two types of mental illnesses. One is a major mental illness, another one is a minor mental illness. The major mental illnesses, I'm sure many people are aware of, such as schizophrenia, affective disorders, OCD. These are the major mental disorders. Those constitutes only 3% of the total population. But what we are worried also equally is about the minor mental illnesses. These minor mental illnesses are something like depression, anxiety, panic, phobias, suicide, the alcohol and addiction. These are the other minor problems. These minor mental illnesses constitute anywhere up to 20 to 25% of the population. Imagine this country has 1.2 billion population. With that, if I'm talking about 20 to 25%, it's a huge number. Mental health means there are so many minor mental illnesses. Example like a depression or an anxiety. Any person who is depressed definitely will not be able to contribute to the efficiency. The efficiency goes down and naturally the quality of the life suffers. His quality of life suffers, and not only his but also the work suffers. Or if it is in the family, the whole family suffers. It is not a individual who is suffering. It is the whole family and the whole environment where he lives or where he survives. See, the mental illnesses are many a time hidden. And once it is hidden, it doesn't come out. I have a problem in my leg, so I can go to a doctor and say that this is my problem. On the other hand, I may be depressed, but it is not obvious to the other person. So this requires a recognition very early. So any person who is having a problem in them, they have to come and approach the doctor. And this has to be learned and one has to be aware of this. That means awareness among the common man is extremely important. Just because there is a mental illness is there and a stigma is there, they don't approach the doctor. So they have to be brought by somebody else forcibly. They do not have an insight into illness. For example, I am a physically ill person. I have got fever. I know that I have fever. I go and approach the doctor. But the mental illness, they think that they are all right. They are normal. They are as normal as anybody else. Once they do not have an insight, why should they approach the doctor? So that means it is the responsibility of the carer who has to care for these patients and to bring to the doctor, and then only the treatment can be given. So that means a common man has to know what is these mental illnesses and how it can be treated. That means awareness among the common man is extremely important. The mental illnesses are like other non-communicable diseases. It is a part of NCD. What are those NCDs? The NCDs are common hypertension, diabetes, ischemic heart disease, which everybody knows about. So mental illnesses is now part of NCD. That means it is a part of non-communicable diseases. It is just like hypertension, just like diabetes or ischemic heart disease. So now our mindset of the common man should change. How we recognize the common illnesses like hypertension, diabetes or asthma, we need to look at mental illnesses in the same line. And these mental illnesses are eminently treatable now. They can be treated completely. Some of these minor mental illnesses are perfectly be treated and they are back to normal. They lead a normal life like anybody else. Absolutely a good quality of life.